Usually they don't cause infection unless patient is not keeping the required hygiene. It is better to use in case of any visual field problems which is caused by the glasses. There are limitations in case of infants and young children, and also elderly people who are not able to meet the hygiene requirements.
Hello dear friends, good evening. We are back with yet another episode of BMC Global Live Al-Hilal Health World, Nothing But Lifestyle. And I am Jasila Mujib, your host for today. Today we will be discussing about contact lenses. From correcting vision to enhancing appearance, contact lenses have come a long way since their early invention. And we would be discussing this subject with Dr. Dheeresh from Al-Hilal Hospital, Salmabad branch. He is a consultant ophthalmologist with an experience of more than 15 years. So, Doctor, welcome to the show.
Hello.
Doctor, today our topic of discussion is contact lenses.
Okay.
So, can you explain the difference between glasses and contact lenses?
Yeah, contact lenses are devices which are placed on the surface of the cornea. A good contact lens is a one which is having a good optical qualities, which is easy to use, comfortable, and also which has a good oxygen permeability. Glasses are the conventional way of treating a refractive error, but of late we have the contact lenses. Glasses are more comfortable to wear because the wear and tear is less. Contact lenses require more hygiene. The glasses are made up of polycarbonate material, but the contact lenses are made of polymers. But in the case of contact lenses, we get a broad vision. So it is better to use in case of any visual field problems which is caused by the glasses.
Doctor, who can wear contact lenses? Is there any age restriction?
No, almost everybody can wear contact lenses. There are limitations in case of infants and young children, and also elderly people who are not able to meet the hygiene requirements.
Doctor, now can you explain about the different types of contact lenses available in market today?
Yeah, the contact lenses are basically broadly divided into two. That is based on the material they are made and also the extent of the wear. Based on the material, they are divided into hard lenses, rigid gas permeable contact lenses, soft lenses which are hydrogel material, and also silicone hydrogel. On the basis of the classification, on the basis of extension of wear, they are daily wear contact lenses and extended wear contact lenses, and conventional and disposable ones.
Doctor, what are the common myths associated with contact lenses that you often face in Europe?
Yeah, the most common question people ask in the clinic is are they comfortable to wear? Yes, they are very comfortable to wear. Then does they cause infection? Usually they don't cause infection unless the patient is not keeping the required hygiene. Then can it go behind the eye? It can't go behind the eye, but there is a barrier, conjunctival barrier, so the contact lens can't go behind the eye. So these are the common ones which you commonly see in the OP.
Okay, so Doctor, what are the common mistakes people make while wearing contact lenses?
The most common mistake people make is not keeping adequate hygiene. Then people can use prolonged use of the contact lenses. They may sleep with the contact lenses, can use the contact lens while swimming and taking bath. Another
common query is, Doctor, can contact lenses cause infections? And if so, can they be prevented?
Yeah, infections can be caused by the contact lens if adequate hygiene is not maintained. So it can cause infection of the cornea, infection of the conjunctiva. It can be a viral, bacterial, or a parasitic infection. So we recommend adequate hygiene for contact lens users.
Now, Doctor, can you explain about the proper way to clean the contact lenses and how to store them?
Cleaning the contact lens start with a clean hand. You place the contact lens in the palm of your hand, clean with the multi-purpose solution for 20 seconds, followed by a fresh solution for the 10 seconds. Then keep the contact lens in the case which is filled with the fresh solution, and make sure that the case is discarded every 3 to 4 months because it can contain contaminants. The most common mistake people do is washing with soap water. and also reusing the solution, which can attract contaminants because the disinfectant property of the solution is lost when you reuse it.
So it should not be washed with water.
It should not be washed with water never.
So doctor, another common query is, can we sleep or swim using contact lenses?
Yes, sleeping and swimming with the contact lens is not recommended. Prolonged stay of the contact lens on the cornea causes hypoxia. In swimming with the contact lens, it can cause infection, and also it can attract the chemicals in the water which can destroy the structure of the contact lens, and also sometimes you have dislodgement of the contact lens. So we recommend in swimming not to use contact lens. We suggest using prescribed goggles. If you don't have a prescribed goggles, you can wear contact lens, but usage of a tight goggle.
Doctor, how do contact lenses affect people who spend lots of time in front of the screens?
Prolonged exposure to screens causes dry eye and strain. So we recommended people to follow the 20-20 rule, which is after 20 minutes of exposure to the gadget, look at a distance of 20 feet for 20 seconds. This decreases the dry eye, and also ask them to use plenty of eye lubricants. Also hydrate themselves. We also advise them to adjust the brightness of the screen, and also to adjust the room lighting. Also, there is less contrast between the screen and the room.
Doctor, do you recommend long-term use of contact lenses?
Now, I don't recommend long-term use of contact lenses, but it can be used in a specific situation where the patient is a high myope, provided that your exposure of the contact lens per day is less and adequate hygiene is maintained. I recommend the patients to see a corneal specialist or at least an eye specialist to ensure that the cornea is in a proper healthy condition.
And doctor, what are the new technologies that have evolved in the contact lens industry?
We have a variety of contact lenses in the market. Other than the therapeutic and optical usage, we have contact lenses with ultraviolet coating. We have multifocal lenses which can be used for presbyopic people. That is, after 40 years of age, you can use the contact lens for reading, which is commonly asked nowadays. We have contact lenses with a telescopic vision, which are used particularly in certain diseases of the retina. Then we have contact lenses for diagnostic purposes, which are used for measuring the intraocular pressure of the eye and also the blood sugar. Then there are contact lenses, even though I said it can cause dry eye, there are contact lenses which can be used for dry eye also. So there are a variety of contact lenses in the market, so which can be used for a variety of reasons.
And doctor, what is your takeaway message for our viewers?
Contact lens can be safely used provided the hygiene requirements are maintained. People who are on the screen for a prolonged period of time, I recommend them to use the eye lubricants frequently. Make sure that they are not having dry eye and there is no signs of infection like watering, redness or discomfort or itching. And also people not to sleep with the contact lens, and also not to swim with the contact lens. These can cause infection.
And doctor, finally, what do you have to say about Al-Hilal Healthcare Service?
Al-Hilal is the fastest growing healthcare in Bahrain. I am fortunate to work for them. I am available in Salmabad branch in the morning and evening hours from 9 to 1 and 5 to 9.
Thank you, doctor. Thank you very much.
Thank you.
So viewers, if you are a long-term lens wearer or someone thinking of switching from glasses or just curious to watch, I hope this episode was helpful. For more informative episodes, tune into BMC Global Live Al-Hilal Health World every Tuesdays at 8 p.m. Till we meet again in next episode with a new doctor and a new topic, this is Jasila Mujib signing off. Good night.